Good afternoon, everyone. I'm Judith Helzner, and I'm the Director of Population and Reproductive Health at the MacArthur Foundation, the John D. and Catherine T. MacArthur Foundation, which is based in Chicago. MacArthur is a private, non-governmental grant-making institution, and we work in about 60 countries around the world, as well as in the U.S. Our international programs include conservation, human rights, peace and security, as well as population and reproductive health. And my interest is in promoting Millennium Development Goal 5, improving maternal health, both through achieving Target 1, reducing maternal mortality, and Target 2, universal access to reproductive health. MacArthur Foundation supports programs on reducing maternal mortality and advancing young people's sexual and reproductive health and rights. And our geographic focus is on India, Nigeria, and Mexico. And India and Nigeria combined account for 1/3 of all the maternal deaths in the world every year. As Ann Stars noted in her remarks, postpartum hemorrhage is the most common cause of maternal mortality, and it represents about 1/3 of all maternal deaths. And it is possible to reduce that number dramatically in the years ahead. We know how to do it, and we need the resources and the political will. And I want to give you just an example of how we can reduce hemorrhage and another cause of death, eclampsia. For hemorrhage, the drug misoprostol has been demonstrated to prevent 50% of postpartum hemorrhage from occurring in low-resource settings. So if the 50% of hemorrhage that can't be prevented does occur, there's a device called the anti-shock garment that has the potential to reduce those deaths by up to 60%. So combined, misoprostol for prevention and the anti-shock garment for stabilizing women who do experience hemorrhage could prevent up to 80% of all postpartum hemorrhage deaths, and that represents about 1/4 of all maternal deaths, which is about 1/3 of the way towards the Millennium Development Goal target. The anti-shock garment is made out of neoprene and Velcro, and it's applied to the lower body to help keep blood in the upper body and buy time for a woman to be transported to definitive care. And MacArthur is supporting both of these interventions, research and pilot efforts in India and Nigeria, and we hope that partners, including governments and the private sector in those countries and elsewhere, will take those proven interventions to scale. I just want to mention for a moment that we're also supporting work on promoting the use of the drug magnesium sulfate, which is known as the drug of choice to prevent deaths from eclampsia. Magnesium sulfate is very inexpensive, but it's often not available or not used. We know the barriers that need to be overcome, and a group of partners could definitely help achieve that as well. Young women, both married young women and unmarried young women, deserve, of course, sexuality education and access to reproductive health care and family planning. Not only MacArthur Foundation, but other private foundations in the United States are committed to Millennium Development Goal 5, both Target 1 and Target 2. And as an example, together, the William and Flora Hewlett Foundation, the David and Lucille Packard Foundation, and the MacArthur Foundation made grants related to those two targets of MDG 5 of nearly $100 million in 2008, and the same or more is planned for each of the coming years. So U.S. private philanthropy is a valuable partner to governments, UN agencies, and the private sector for piloting new approaches, acting rapidly with flexible funds, and catalyzing alliances to tackle global health problems. MacArthur Foundation is very proud